Hello and welcome to WashingtonExec video series. I'm Amanda Ziadeh, Senior Writer with WashingtonExec, and today I'm joined by Jennifer Welham, Senior Vice President of Public Health at ICF. Thank you so much for joining me today, Jennifer.
Thanks for the opportunity, Amanda.
Of course. So today we're here to discuss a very, very timely topic, the current and future state of the public health industry. So I wanted to start by asking you how you would describe the current state of the public health industry, and where are the gaps and challenges, or has it improved our ability to respond to a crisis like the current pandemic?
Well, simply stated, I would say the entire public health system is under extreme duress right now. One of the main challenges is the highly fragmented state of the public health information systems. So there's nearly 3,000 local, state, and federal health departments in the United States, and they set their own reporting rules, and their ability to send and receive data electronically varies greatly. Many healthcare workers have to fill out paper forms on COVID-19 cases and available beds, and then they have to fax them to public health agencies if they don't have electronic data. This is causing critical delays in care, and it's also hampering the effort to track and prevent the spread of the coronavirus. Another critical challenge is effective communication of accurate, evidence-based information. I think it's no surprise for listeners to hear that there's a significant amount of misinformation about what to do and what not to do to stop the spread of coronavirus and COVID-19. So, for example, a few I pulled from the media, a Michigan library had asked patrons to stop microwaving books to kill the coronavirus after noticing that books that were returned with scorched pages. And another one I read about, the Cleveland Clinic had to issue public warnings about the danger of using vodka concoctions as a hand sanitizer. Recipes started circulating on the internet. Also, public trust in government is really at an all-time low, which is impacting contact tracing efforts and other response tactics.
And I know this was an extensive report, but what were some of the key findings from ICF's original COVID-19 research into public perceptions of the pandemic, and how do these findings emphasize the challenges that you just expressed?
Well, we've learned a lot of things from our research. In case the viewers aren't aware, ICF has conducted a survey of U.S. adults monthly since late March, and it's ongoing monthly. Topics include public health, economic and personal finance, mitigation, and mental health. The survey questions remain largely consistent from wave to wave, and this allows us to track how American attitudes about COVID-19 are changing over time. And as you mentioned, there's a lot of results, but one thing that was very interesting that we learned in the June fielding of the survey is that believing that information about vaccines from government health officials is reliable and trustworthy is positively correlated with a willingness to try a COVID-19 vaccine. And unfortunately, fewer than 2/3 of the respondents agree that information about vaccines from government health officials is reliable and trustworthy. And what's also disturbing that we found in our June survey is that trust in information provided by federal, state, and local governments fell for the third straight month. So, as you mentioned, there's a lot of information, and I'd be happy to share it if people want to reach out to me directly through LinkedIn or check it out on our website.
Absolutely, and we'll be sure to share the report as well. So my last question for you is really, how do we fix those challenges and gaps in the public health industry, and what is ICF doing to help?
Well, I think first of all, we need to prioritize getting critical data into electronic format, and preferably without manual data entry. We also need to make our mini public health information systems interoperable and interconnected to the maximum extent possible. One example of how ICF is supporting these efforts is our work on CDC's BioSense platform. BioSense is a real-time surveillance system for syndromic data. And in case people aren't aware, syndromic data is information about clinical symptoms individuals have, like fever, headache, or cough. And because the symptoms are often discernible before people get a formal diagnosis, they can be used as early indicators of disease outbreaks. Just to give you a sense of the scale, BioSense receives 6 to 8 million electronic health records every day from over 5,800 facilities, and that represents about 75% of hospitals nationwide. And the data is available for use within 24 hours of patient visits to these facilities. One other thing I'll just add as we wrap up, we also really need to focus on getting the right information to the right audiences through sharing of evidence-based communication. And an example of how ICF is supporting these efforts is in collaboration with the HHS Office of Minority Health and the Morehouse School of Medicine. So we're engaged in a 3-year project to work with community-based organizations to deliver education and information on resources to help fight the pandemic.
Well, thank you so much for sharing these findings and information with us. It's an extremely timely and relevant topic and something we should all be thinking about. So thank you so much for joining me today, Jennifer.
Thanks for the opportunity. I appreciate it.
Of course. Thank you. Bye-bye.